My area of research is exercise and oncology, and I like to look at the various elements of the relationship between the two. I like to look at how it affects psychosocial outcomes, how it affects physical, functional outcomes, and even how it affects the physiology of the human. Prehabilitation is a really exciting area in exercise and cancer research. We have generally looked at exercise as it pertains to the experience after treatment, but the role of prehabilitation really looks at the role of exercise prior to treatment. And the exciting opportunity here is that very often you have a period of time where patients haven't necessarily been debilitated from their treatments that allow us to perhaps push the limits of their physical capacity to really train them up prior to treatment. And it's just like training for a race, exam, or interview. You need to be prepared for that particular stressor. So the concept behind prehabilitation is creating that buffer between the time that you're diagnosed and the time that you're treated. So it allows you to withstand the rigors or the challenges of the treatment much better. So engaging in exercise on a routine basis is a difficult habit to start and sustain. But if you add a number of complexities associated with a diagnosis of cancer, the psychological, emotional, and social experience of that diagnosis really make exercise quite difficult to add on top of that. But then you have to add the complexities of the physical and physiological changes that are associated with treatment. Then you add on top the burden of the treatment itself from a time perspective, whether it's the appointments or the fatigue or all of the other challenges to building it into your schedule. So there are a lot of challenges to exercise within the lifestyle habits of someone who's been diagnosed with cancer. Programs like ours at the Princess Margaret, the Cancer Rehabilitation Survivorship Program, do our best to try to support patients after a diagnosis so that they have the resources they need to exercise on an ongoing basis. But it's a difficult lifestyle change to make that needs quite a bit of support. Pain and fatigue are so problematic for people who've been diagnosed with cancer. And one of the most challenging parts about those symptoms is that they can fluctuate on an hour-to-hour basis, day-to-day basis, week-to-week, month-to-month. And this ongoing fluctuation as it pertains to exercise requires some adaptation. So if a person comes in feeling well in the morning, but by the time they arrive at their exercise program not feeling so well, an important element of the skill set of that professional delivering exercise is the ability to adapt to who that person is when they start their exercise. And that can really change quickly. So creativity, adaptability, and the ability to work with the patient as they present in the moment is key. But that's on top of a strong fundamental skill set that pertains to their understanding of the pathophysiology of cancer, as well as the physiology and some of the behavioral, psychosocial outcomes related to their treatment. With the growth of all of the research supporting the safety and benefits of exercise, we have actually been able to establish evidence-based guidelines around how to deliver exercise programming. So we now have guidelines produced by the American College of Sports Medicine, but as well as Cancer Care Ontario, that provide direction around how to provide exercise to people who've been diagnosed with cancer. Those are great points of first contact for the healthcare professional that really are interested in providing this level of programming. They include target volumes for exercise, which are standard and consistent with World Health Organization and Canadian Society for Exercise Physiology guidelines. 150 minutes of moderate to vigorous physical activity per week is what is recommended for individuals who have been diagnosed with cancer. So those guidelines are the target. The support that the American College of Sports Medicine and Cancer Care Ontario provide within their guidelines include elements of how to cater to the challenges that someone with cancer may face in the course of their pursuit of an active lifestyle. When I look to the future of supportive care, what I really hope to see is a future where exercise is integrated into the broad management of every individual's care after a diagnosis of cancer. before treatment, during treatment, and even long after treatment, the evidence are so strong that suggests its safety and benefit that we have a real opportunity to improve the lives of these people with cancer. And I think exercise is so well established that we really should be putting it in. Exercise is key to enhancing quality of life after diagnosis.